between Becky and
Uh-huh.
you and I.
Yep.
So if you need any help relaying any information to anyone, you just let us know. Like,
No,
we're
but give me
here.
your take on
Yeah.
his physical
Yeah.
health.
So he came in worried about the blood that was in the urine
Uh-huh.
stool. And when he came in last night, they did an x-ray of his chest,
Uh-huh.
and in the x-ray it showed concerns for masses in the lungs.
Okay.
So they did a CT scan of the thorax, which
Mhm.
is the chest and the upper part of the abdomen.
Yep.
And in there, it showed nodules or masses
Yep.
throughout the lungs that were concerning for cancer.
Yeah.
And you could see the top of the kidney, which also showed masses concerning for
Okay.
cancer. So we came to him and said, you know, this is what we found.
Mhm.
This looks cancerous to us. The next steps would be to image two things, the brain and the whole abdomen and pelvis, so that we could get a better image
Yeah.
of what's going on. We don't have to do that if that's not your wishes. And he relayed to us that he would like the scans, but he would like to think about
Yes,
steps
exactly.
2 and 3,
Uh-huh.
because steps 2 and 3 are a lot more invasive.
Yeah.
So the brain scan was clear. There
Mhm.
was no remnants of cancer in the brain.
Uh-huh.
The scan of the abdomen and pelvis showed a couple things. It showed the right kidney is completely replaced by an 8-inch by 8-inch mass of cancer.
Okay.
So that's a very large mass. So it's shocking to us that he actually doesn't have any other symptoms besides the
That's where the urine the blood in the urine is coming from?
Correct.
Okay.
Correct. The second thing it showed was the kidneys have two pretty big tubes that meet up into one
Yeah.
large tube that enters the heart.
Yeah.
Those are the renal arteries that
Yeah.
go into the inferior vena cava, the
Uh-huh.
IVC. And that's a real big vein that comes to the heart, and it brings all the blood from the body into
Yeah.
the heart. The cancer from the kidney has traveled into that big tube, the
Okay.
IVC, and it's occluding part of it, meaning the tube is now
Yeah.
closed part way with
Okay.
the cancer. So that cancer has potential to move to other places
Yeah.
of the body. What we'd be most concerned about is the brain, and it doesn't show anything right now.
Good.
Because of the size of the mass and
Yeah.
that it's already metastasized to the vessels
Yeah.
and the lungs, we would think that that has been brewing for
Yes.
quite some time. And he has not shown a whole lot of symptoms that he's
No.
in pain, that he's
Nothing.
losing weight, that
Yeah.
he's having fevers.
Losing about 20 pounds over the last year, but that's
Sure.
I
And
thought
he's
because
al-
of age.
Right, and he's also 91.
Yeah.
So we honestly were not expecting the mass of this
Okay.
size because he actually looks fairly good for his age,
Uh-huh.
and he has a pretty good quality of life.
Yeah.
So what
So
we-
is there
yes.
probably going to be a surgical procedure because of the blood?
So there does not have to be unless him and the family wants it. So that's for two reasons.
If you can fix the blood in the urine, I guess we won't have to do that. But if you can't without a surgical procedure, well then,
So we would not be able to fix the blood in the urine. We'd be able to we could put a Foley catheter in to give him more comfort.
uh,
But that's kind of where we lie now, is we
All right.
have to discuss with you guys what sort of procedures you would
yeah,
be okay
I'll
with.
wait for Becky to get here, and I don't know what time she's going to be here. She can
And
be here
that's
anytime.
okay. That's
yeah.
okay. So if I'm still here, it'll be me explaining. If not, it'll be Dr. Florendo and Dr. O'Coin, who are here overnight, who actually
Yeah.
admitted him yesterday. So they're well aware,
Okay.
and I've told them, and they have all access to his charts. So they're a part of our team, but they're here overnight. So if she's not here until later, that's absolutely fine. So and they'll relay the same thing. So
I think he's going to need something to
so,
go on.
Yes and no, because he is bleeding and because of his age,
Uh-huh.
invasive surgery is not
Okay.
not something
Because he's not strong enough to
Right.
withstand it, probably.
right. And then the second part of that is to what end? If we go in
Yeah.
and we biopsy it and we learn about the cancer, do you plan on going through with chemotherapy? Because the size of the mass and where
Yeah.
it is, chemotherapy is not going to get rid of this cancer.
right.
So now the question is chemotherapy versus not, you have to look at quality
Yeah.
of life. I'm not saying that he's, going to pass away in days,
Yeah,
and it might not even
His
be
quality
months.
of life was great until a week ago.
That's what I'm saying.
Yeah.
So you can treat the pneumonia, we can give him
Uh-huh.
antibiotics, and likely he'll be back to what he was a week ago when he leaves here. But
Uh-huh.
you have to think about as a family,
Yeah.
is this something that you're going to say, you know what, your quality of life is good, and this has been here for a long time. Let's live out whatever remaining years you have
Yeah.
comfortably, and as you have been, and let your body naturally
Uh-huh.
run its course. If you go ahead and you're doing invasive procedures where you're putting tubes and poking in needles and grabbing
It's-
chunks of your kidney,
yeah.
that's really invasive, and those procedures have a lot of risk of bleed and clots.
Yeah.
And then risk, if you go ahead with chemotherapy, you have a lot of risk of infection, sores in your mouth,
Yeah.
losing weight, losing your immune system.
It's just
So
it's
your
the
qual-
urination that because he has to urinate,
Right.
and if it's painful with blood,
Right.
so
So we were kind of thinking like if we could put a Foley in, and that way he
and he has a
wouldn't-
bag off to the side. Is that
Yeah,
what you mean?
it's not like a bag that he would have to hang
Yeah.
on him. Like it would be a long tube that
Okay.
would collect the urine, and then you would just dispose of that.
I think that's workable, but we'll talk to Becky.
Right. So there are options to make your urinating more comfortable without going in, without
Yeah.
doing anything invasive, because that, with how far it is along already
Yeah.
at his age, that makes us nervous
Yeah.
going into someone, a 91-year-old, regardless if they have
Yeah,
cancer,
yeah.
we would feel not safe going into. I think that you have a great quality of life as is, whether or not you have this or not.
Yeah.
So I think that what you have to discuss as a family is, do you want invasive procedures?
Yeah.
And if yes, then is that a mean to what end?
Yeah.
You know what I'm saying?
I get you pretty well. Yeah.
So that's something that only you guys can decide. We can give you as much
Yeah.
information as I can from a medical standpoint and my recommendation, but ultimately it's your choice.
Mm-hmm.
Well, that's the way,
Yeah.
I was just telling him that I've kind of made my decision,
Yeah.
and I have told you.
I was gonna say, you relayed that to me when we talked earlier, so,
There's one other thing I'd like, is possibly, you have explained this all to Jerry, all to me.
to Becky, you would like me to
I would
explain?
like you to-
Sure.
I've got a 7-minute video
Wait,
just in
wait,
case.
wait.
Yeah. Go ahead.
I would like for you to take Becky off to the side
Yep,
and explain to her,
yep,
alone, without Jerry.
yep,
or
just
me.
her and I, yep,
Uh-huh.
for
Do you
sure.
agree, Jerry?
That's fine. Yeah.
For sure.
That is fine.
For sure,
I think she ought to hear
yeah,
the same terms that
absolutely,
you are.
absolutely.
Then we got her opinion alone. Jerry is agreeing, sounds like, with me,
Yep,
Mm.
and you are agreeing with
I'm
me.
agreeing with you as well.
So I'm not hurting.
Right,
Yeah.
I can't see, if I was suffering, I would lay here and just say, get me the hell
right,
out of
yeah,
here.
exactly, yeah,
But I'm not.
right,
And I think that I'd like to just try for a little bit longer,
absolutely, I agree.
if it suits Jerry
Yeah.
and Becky.
Sure, yes,
But I'm not gonna, I don't wanna push a burden
yeah.
on them either.
Yeah, and just so that you know, so I will be here all weekend and through next week. So I'll make sure we clear up your pneumonia, and you'll be gone next week most likely once we kind of get your infection cleared up.
Mm.
Right.
So when it's time to leave the hospital, once the pneumonia is cleared up, that'll be with me. I'll help discharge you from the hospital. We can have measures in place in case down the line, weeks, months, years from now, you start feeling not so good.
Yeah.
And those measures would be home care, where someone can come to the home,
We've discussed that. Yeah. that's,
help you feel comfortable. They can bring an IV with them. They can do things like morphine. They can do things to help you feel comfortable if down the road you start to feel not so good. Okay, so that would be palliative care and then hospice care down the line
Yeah.
when that time comes.
Because I talked to several of your aides, and I told them that I was having eye problems
Mm-hmm.
also. And they said it's very possible, if you're gonna stay, that I could get an examination
Mm-hmm.
on the eyes here before I leave.
Mm-hmm.
and
So
get
we
glasses.
scanned your brain and we didn't see any clots or anything behind the eyes, which is what we were concerned about.
Yeah.
But we can ask the ophthalmologist to come in and look at you
So
as
that
well.
would help me, Jerry.
That'd help you a lot.
Yeah,
Yeah.
sure.
I'm out, it's just not,
Yeah.
they're failing,
Yeah,
and they're only, what, 20 or 30 years old.
Yeah.
for sure. We can get them to come see, because you're going to be here with us for a couple of days while we treat the pneumonia.
Well, my biggest problem right now, I'm so damn relaxed, and I'm thirsty, but I take one swallow, and I
Yeah.
gotta go to the bathroom.
Yeah, so we can talk with the attending physician to see if she's okay with putting a Foley in you, just to help with some of the discomfort. And just, you don't have to try and get up to use the bathroom. It would just be a lot easier.
This has been great,
That's good.
Jerry, with this, they have changed me 3 times today.
Yeah.
And I haven't gotten, the one time, the first time,
Mhm.
was on the porta potty,
Yeah.
what do you call it?
Yeah. Yeah.
Can.
Yeah.
And that was miserable.
Yeah.
Yeah. It is.
Then they told me, just go ahead and let it go.
Yeah.
It's easier for them to clean up, and it's twice as easy for me.
Yeah.
Right.
So I just
Good.
run in here and
Yeah.
relax and then go and get back.
Mhm.
There you go. There you go.
So-
Right. Does anyone have any questions?
No,
for
you've
me?
been more than
Okay.
explanatory, and
Okay.
usually get 30 seconds from a doctor.
Right.
Yeah, so
Right.
that's great.
I know that she's been great with me.
Yep.
Of course, I knew